Okay. Well, welcome everybody. Thanks for joining again this week for another one of these team sessions. And today I just want to give a brief introduction to our Dynamed point of care clinical reference tool resource. As I was mentioning before, it's really a competitor for UpToDate, whereas UpToDate is from Ovid or Wolters Kluwer. EBSCO is the company that makes Dynamed. They're really trying to break into this space that's kind of been a monopoly for UpToDate for a while. And it's a really good option. There's some really great things that Dynamed does that UpToDate doesn't do. They're just different. But the idea is they're used in the same way. And to get to this resource, if you go to the LUCOM library page underneath databases, these are alphabetically listed, so Dynamed's right there. It's also in the A to Z medical databases and maybe in the quick links, I think, if you go to the research guide, but it's right here. And if you use UpToDate, that's on here as well. So a couple things I want to show is just kind of the difference of how things appear in Dynamed versus UpToDate. I know some aren't familiar with UpToDate, some have maybe used it clinically before. It's a similar kind of interface. There are search suggestions here that you can do, but just as an example, one of the things that we kind of point out a lot is sometimes Dynamed can seem a little less text heavy. So if I were to, you'll see that it starts to make suggestions as I type my search, and it'll like truncate and look for hypertension, hyperthyroidism, hypertensive emergency, or I can go directly to one of these categories. So if I click hypertension, it's going to give me a couple options for the information that's available for that topic. And it's going to take a while. Oh, okay. Well, stop that. So it can take me right to overview and recommendations, evaluation. You'll see over here in the task pane that it has complications and prognosis, guidelines and resources and patient information. Something that's kind of cool that Dynamed does is that it has images and updates available for this topic, which is organized a little bit differently than UpToDate. Whereas if we were to look for hypertension in UpToDate, it's going to bring over overview, drug therapy, but instead of image or updates here, it's going to give us the option in UpToDate for adult, pediatric, patient information, or graphics or images available. So it's just how it's organized a little bit differently. But something that's really cool about Dynamed is that you can actually search by specialties here. You'll find this little drop down underneath the, if I can get back to it. My network is going kind of slow. So under specialties, we've got all these different medical specialties: oncology, neurology, psychiatry, and I can look at topics available in these specialties, which is something that's kind of unique from UpToDate. So if I were to say family medicine, I can then go into pediatrics, general adult, obstetrics, geriatrics, and then it's kind of like digging down through instead of searching. If you've used UpToDate at all for drug information, you're probably familiar that UpToDate connects to the Lexicomp drug database, which you may be familiar with. They have a similar feature here in Dynamed, drugs A to Z, but it uses this IBM Micromedics, but it's the same kind of tool, just a different product, but it has the same kind of information. So you can find drugs by trade name, find dosing information, patient education, toxicology. Something that's kind of neat, and I have to admit I'm not familiar if Lexicomp has this, but there's a drug interaction tool. And I can actually put in trade names of drug 1 and drug 2 and see if there's a negative interaction or interaction I need to be aware of between those two drugs. So that might be kind of useful for our pharmacology faculty, or even just clinically, if you want to use this in the clinic. And you're trying to decide if you want to prescribe a drug based on what the patient already takes. There is evidence-based medicine medical calculators. It's called EBM Calc here, and we can use it for clinical criteria, medical equations, unit and dose converters. It's just a medical calculator. I've talked about some resources like this before that were separate resources for students. Like I think it's called Diagnosaurus might have a medical calculator in it. I believe UpToDate has a medical calculator as well. So if that's something you want to have in a point of care clinical reference tool, it's available in both. It's in calculators available in UpToDate, and then EBM Calc in Dynamed. And of course, UpToDate has this drug interactions too, but it's just using the LexiComp database instead of the IBM MicroMedX. I wanted to show you that you can sign up for an account to have a personal account with Dynamed, and I already have one, so I'm going to sign in so you can see some of the things that lets you do. And one of the things you can do once it logs in is, am I signed in now? Okay, so there I am, I'm more set. So if say I were to go to Specialties and let's say family medicine, geriatrics, Alzheimer, dementia, I can sign up for updates within Specialties. I'm not sure why it's going so slow down. Maybe something's going on with the network, but you can sign up for updates within Specialties. So anytime something new gets added to this specialty, you can automatically get that sent to you to your account, and you can use this tool up here to bookmark it. You can print this information out, and but anyways, you can get updates for different fields that you're interested in. And something else you can do is you can use CME. You can get CME for what they call MOC, maintenance of credit, maintenance of credits or something like that for depending on whichever board you have. So you can actually collect CME based on your searches that you do in Dynamed. I forget the category it is. I'm not sure how it compares to UpToDate, because UpToDate has something similar where you can claim CME, but I think it's like category B or something like that. It's a little bit different than like actually going to a conference or something you have to be tested on. And then that's basically what I wanted to. Sorry, go ahead.
Last time I checked on UpToDate, they did not have an affiliation with the American Academy of Family Medicine family practice, but Dynamed seems to have that, so that's really a benefit.
Okay.
Yeah.
Okay. Yeah, it's something. I know that you guys have some significant burdens for maintaining your CME, so this is something that can help with that. Something else that I was going to mention, kind of along with an aspect of the mobile app. Most clinical faculty, I'm aware, are using these on their phone in a clinical setting, seeing patients. There is an app available for Dynamed, just like there is for UpToDate, and you can actually find it. You don't want to go to like your app store on iPhone or Google Play. You actually want to click mobile down here at the bottom of Dynamed, and it will give you links. And you can do this in a browser on your phone, whether you're using an iPhone or an Android phone, and then use these links to get to that app. And there's instructions here about how to authenticate it, but it's basically you have to re-authenticate it. I think it's every 6 months. I get confused because Dynamed, UpToDate makes you do it every 90 days, I think. But the re-authentication process for the app on your phone is as simple as going to our medical library page, clicking on Dynamed, signing into it, and signing into the resource with your login, and that re-authenticates the app for you. And the last thing I wanted to mention, as it pertains to the mobile app, something really cool about Dynamed is that you can actually do something called a partial or full install onto your phone. And while around here that might not make much of a difference, but if you're in a place where you don't have reliable network access, whether it's medical missions, whether it's just a place that just doesn't have coverage, they don't have good Wi-Fi or have good you don't have a good cellular data connection, you can download the full content. It takes up a lot more space on your phone, but then you don't have to have network access to be able to get any of this information. It downloads it all onto your phone. So if you have the space to spare and you may be going on medical missions, or maybe you're doing something in South Boston, or something where you don't have good network access, that's a really cool feature that this provides that UpToDate does not provide currently. So that's just kind of the gist of what I wanted to show, and it's not real in depth. It's not really complicated. This is pretty straightforward. I know, I think before I went straight to hypertension, but if I just search for hypertension, you can kind of see how this is a little bit different than what UpToDate. When you're using this on your phone, you'll probably notice even more so that Dynamed's a little less text heavy than UpToDate is. But again, something UpToDate does that Dynamed doesn't necessarily, it's just organized differently, is they automatically separate out adult, pediatric, patient information and graphics, whereas Dynamed puts our videos and any images available up there instead. But you can see they have the same information here: hypertension in older adults and children and adolescents. So that's basically it. That's really brief. We can talk more about it if you guys are interested, but I was going to go ahead and see if there were any questions about it or anything that you wanted to see that we didn't show. But
Robert,
if not,
the phone app versus the app on the library page.
Yes, sir.
If you're signed into one with your own sign-in, will that transfer if you download the app on your phone?
It should, but you still want to follow the link found on, like, you would want to use the browser on your phone and then click on the mobile link and follow the link to the app in the App Store that it has there. And it's got one for the iPhone and for an Android phone. But yes, sir. Okay. Well, thank you guys for your time. And as always, this is recorded, so I'm going to upload it and put it on our research guide, where you can find a bunch of other a small library of videos, these recordings that we've done, in case there's anything else you're interested in. But thank you guys for your time.
Thank you.
Thanks, Rob.
Appreciate it.
Thank you.
Sure.